This is the Progression Health Podcast, and I'm here with researcher Timo Wivelhoff. Timo, can you introduce yourself?
Yeah, sure. First of all, thank you very much, Ross, for the invitation to your podcast. So as you rightly said, my name is Timo Wivelhoff. I'm a professor at IST, University of Applied Science in Germany, Düsseldorf. I'm there the head of a master's degree program called Training and Exercise Science and Sports Nutrition. And I'm happy to be here and be invited by you.
Yeah, it's great to have you here. So you said that you would call yourself a strength and conditioning coach. What are some of the projects you're currently working on, and what is the work that you currently do?
So because of the actual pandemic situation we have worldwide, also we have some COVID projects going on, which is, for example, about the influence of an active lifestyle on long COVID syndrome, for example. So we have some really interesting topics on this, but yeah, my main research topic in the last years was and still is the topic of recovery management. So I'm doing a lot of research on the youth and the effectiveness of recovery strategies, and also on the second topic, which is related to recovery management, namely monitoring of fatigue and recovery in sports. So these are right now my main research areas, apart from some other small projects which are more or less really applied to the field of training and exercise science.
Very good. And if somebody is listening and they don't focus on their recovery right now, let's say they're like, I just need to focus on the exercise. That's all that matters. Recovery, that'll take care of itself. Why should somebody listening consider recovery for general health, and then also for, let's say, performance, if they have a certain training goal they're trying to improve?
So first of all, I have to state that we mainly focus on elite sports when we did the research in the last years on recovery and recovery management, because of course, it's obvious that elite athletes not only train hard, but recovery is like an important part of their training regimes and training plans, because they have a huge training load, a huge competition load, and they have critically plan their also recovery periods. So if you compare elite athletes, for example, with recreational athletes, the training becomes more important because, of course, the overall training time is less. And recreational athletes, for example, let's say they train 3 or 4 times a week, there's still enough time to recovery, so they don't have to focus that much on the recovery period. But as you rightly said, so there's also a health aspect. So, of course, we not only have the sport context, but also the working context, for example. And many people out there working really, really hard, and maybe should also emphasize their recovery and should look on their recovery needs. And that starts with proper sleep, for example, proper nutrition to help to recover better and to feel better during everyday or daily life demands, like, of course, working demands.
So you've heard of DOMS, I'm sure, delayed soreness. I think a lot of people, non-elite exercisers, we'll call them, for muscle soreness, I think this is like a good thing. So basically what you're saying is that if they get the recovery taken care of, their mood, their functioning will be better because they will have less soreness. Is that too much of a jump, or would that be possible?
Muscle soreness is just one part of the fatigue picture. Exercise and fatigue is really complex, of course, like everything, especially if you take a closer look into the physiology of fatigue. So, of course, first of all, muscle soreness is not a bad thing. So it's just some sort of response to training and exercise, which shows that you trained hard, and that is something going on in your body, which then finally probably leads to adaptation to training. So we have to maybe distinguish between a period where, for example, I train hard to adapt, to increase my performance. And in this period, let's say in a team or racket sports, I'm in a preseason and I prepare for the competition period and train really hard. Then I would say muscle soreness is not a bad thing. It's part of the training progress. But on the other hand, if you, for example, in a competition period where you had a competition and where you have to focus on recovering fast to be in a state of readiness, because next competition is only a couple of days away, then of course it is important to recover fast and maybe also to get rid of the muscle soreness, which maybe of course, influence in some way not only your mood, but also your performance, also your well-being, and so on. So, of course, in these different kind of scenarios, it's recovery.
The Progression Health podcast has teamed up with TRX. So TRX is a bodyweight training piece of equipment that you can hook up anywhere, anytime. And I highly recommend it. I use it in every session with my clients. I use it to warm up and also for stretching. But if you are traveling, which is where I recommend everyone use it, it's hard to get to a gym. It's hard to find the time. But you could literally work out from your hotel room with the TRX and the door attachment that it has, where it doesn't damage the door, but it gives you an effective workout. I also like to add in other things like glute bands and resistance bands. But once you have the TRX, then you can figure all that out. So get yourself 50% off on the TRX home workout equipment with the code Progression Health TRX and boost your workout effectiveness and consistency. Progression Health podcast is brought to you by BetterHelp. BetterHelp is an online therapy service which will help you to more effectively manage your mental health. Mental health is very important, and it's something that all of us are realizing now, especially after the pandemic. During the pandemic, for me especially, it was very challenging, and I reached out to BetterHelp. I tried out a few of their licensed therapists, settled on one for the majority of the pandemic, and I found the help that I received invaluable. And the great thing also is that you can speak to your therapist outside of sessions. If it's not working out, you can switch. Very affordable. It's really easy to use also. And if someone hasn't tried therapy before, but you're kind of, you're curious, I would highly recommend BetterHelp. So what we've done is we've got a sign up link I'll attach in the show notes, and basically you can get a discount to get started and start improving your mental health today. So BetterHelp for better mental health.
Or recovery strategies may help to overcome muscle soreness in a good way. But to finish it, I mean, overall muscle soreness is not a bad thing. And also elite athletes, even though they train every day, will experience muscle soreness. So everyone will experience it, and it's just a reaction of response of the body. And it shows that you worked hard and you will probably adapt. So the question is, do you accept it? And maybe you work or you wait 2 or 3 days before you start your next training session. Or, okay, in one day I have my next competition and I have to recover now really fast. And then I have to think about what should I do to now recover fast and be in a state of readiness in, like, let's say 24 or 48 hours when the next competition is going to start.
Interesting. So what I thought previously was that if you had muscle soreness, it was an indication you did too much. You trained past your ability to recover, and that's why you're feeling soreness in the days preceding your workout. So you're saying soreness isn't a bad thing, and it's how you accept it or not. So soreness, or my view of soreness, it sounds like it's kind of wrong, or I should adapt it. What do you think?
So it's not. First of all, it's not a bad thing. I mean, it's a natural response to training, especially if you train hard. Not every exercise or a sport or discipline will lead to muscle soreness. So, for example, if you go swimming, you will probably not experience much muscle soreness. But for example, if you do heavy strength training, you will probably have a lot of muscle soreness. So it's a natural thing, and we have to accept it. And it is something not only, as I said, elite athletes experience. It is also something recreational athlete experience, or someone who is just doing. I try to find the right word, but someone who's doing something which he's not used to do, or she. So if someone is doing strength training for the very first time, and even though it's not a heavy strength training session, he or she will still probably experience muscle soreness. So overall, it's a natural thing. So it's part of a training process. So we have to live with it, and we can always see it as a good thing, because when we have muscle soreness, we know our body is adapting in some way. So there's some physiological processes going on that will help me to become stronger, for example, or better, or faster, or whatsoever. And it's only the question: do I need a fast relief of muscle soreness? Do I have to, or do I have to try to decrease muscle soreness as fast as possible, because I know next morning there's the next training session or the next competition? Or can I easily live with it and say, okay, I trained hard now I have 2 days off, and then I have my next training sessions in a week? So that's the question.
Yeah, so it's not black and white. It's very almost like a gray situation or nuance. So I feel as though you would need a specific athlete and the time frame to decide what to do. So I guess if you were training towards a performance goal, like you wanted to get stronger, for example, you're trying to increase like your deadlift or your sprint time, and you had no muscle soreness, but you're training, you think you're training hard, would that be a bad thing? And then if you're doing the same goal and the soreness is affecting your quality of life and your mood, would that be a bad thing? So I guess when do you know that the soreness is, we'll say, normal, and when is it kind of like abnormal?
I mean, usually like the muscle soreness we are talking about is usually never abnormal. So if you have soreness which feels abnormal, then you're probably some sort of injured, or you have some sort of overuse or something like this, which is more like orthopedic problem. But if you have the muscle soreness that is common after intensive training or unaccustomed, or I don't know if that is the right word, but after like exercises that are not used to, then it's absolutely normal. And the only question is always the scenario. So if you are let's say in a period where you train, for example, as I said, in the preseason, where you can easily also skip a training session because you're feeling too fatigued, then you don't have to worry about that. The muscle soreness is really hard. But if you are in season, for example, and where okay, I have to compete in 2 days again, and I'm still feeling really sore, then I have to improve my recovery, or have to plan the recovery phases so that I have some sort of speeding the recovery, from muscle soreness. So these are the different scenarios. So I would always say if I train and if I'm, for example, in a preseason, for example, I can easily live with the muscle soreness because I can quite flexible play around with my training plan, and I know my main goal is to increase performance and try to adapt to training. So in this scenario, muscle soreness is a good thing because I know training stimulus was good, and then I can adapt. But if I'm in season, for example, where now I have to compete in a couple of days again, then I have to critically discuss with my coach, for example, or with myself, what can I do now to decrease muscle soreness and to be ready for the next competition, because the competition will not wait.
Yeah, very good point. My coach said that as well to me. He was like, you better keep training because on the competition day, you can't turn up and decide, I'm going back to bed. I don't want to train, or I don't want to work out, So interesting point. So it feels as though your ability to train or perform is only as good as your program over the long term, because things will come up, time will change or whatever. But if your program was poorly planned initially, you're more likely to run into challenges. Whereas if it was better laid out initially, or you have a better understanding of how to monitor and manage fatigue and training, you can make more of the program. Is that kind of the solution basically to manage fatigue, or one solution?
It is definitely one solution. I mean, recovery management, what we are talking about here, is part of training planning, of program designing. And like training planning is, I would say, the most complex task for coaches, because you have to put everything together. You have to plan different kind of training cycles from the whole year to the single training session. You have to define exercises, exercise order, and so on. And if you try to also make these training plans some sort of evidence-based, it's becoming really, really complex. And I would say like the whole training planning is, it is not possible to base the whole training plan purely on evidence because it's too complex. But in some parts, you can definitely try to put evidence into your training plan. And recovery management is always part of this training plan. Because, of course, mainly you plan the training sessions, but especially in elite sports, you also plan the recovery parts between training sessions, also during a training session or between competitions. So, training planning is the whole picture, and recovery management is part of this picture. And of course, we try to make it as evidence-based as possible, but it's not possible to base everything in the training plan and also in the recovery plan purely on evidence because it's too complex, as I said. But that will be the overall picture.
Right, yeah. So like a little bit of educated guessing or experience comes in as well, or even the athlete's kind of feedback as well would be important. So
definitely.
So you mentioned long COVID and exercise. That's like very relevant right now. Would you just talk a little bit about that project or anything that you've learned about that, and maybe how exercise benefits people's like overall well-being or just their kind of resiliency?
We are at the very beginning of this project, and we have to distinguish there are people who are suffering really hard on long COVID syndrome, who have serious issues and who are not able to participate in any physical activity at all. That is problematic, of course. So this is not part of the project we are doing right now. So we are working with the people who have light long COVID syndromes, who are still able to participate in physical activity and regular physical activity. And we look on how these people may benefit from regular physical activity in regard or with regard to their long COVID syndrome or long COVID symptoms. So because we are at the very beginning of the project, I unfortunately can't give any results of this project, but I know there are a lot of projects going on right now. I mean, it's naturally because it's just a massive topic, and everyone is interested in that because it's a worldwide pandemic, and many people are, of course, in some sort of influenced by that, and that's mainly the part of that. And I know there are a lot of really, really good research groups working on that as well. And as you said, I mean, our theory is, as with many things, like that is also my personal opinion, my personal experience, but it's also evidence-based. I mean, we know sport and active living is like some sort of the best medication for a lot of things, for a lot of issues, for a lot of health issues. And in both perspectives, not only the perspective of treatment, but also the perspective of prevention, to prevent a lot of illnesses. I don't know if the word is right, but illnesses. So our theory is that at least people who have light symptoms, who are still able to participate in physical activity, maybe can benefit from it. We try to coach them very good. Of course, a lot of people have also psychological issues because they're not feeling really good. We don't have that much knowledge on what COVID or long COVID is doing with the people. So a lot of people are frightened. They don't really know what can I do, what I'm able to do without hurting myself. So we try to support them and to help them, to guide them back to a normal and physical active life, and just look on how it helped them with coping with their long COVID symptoms. That's pretty much where we are right now.
Very good. It'll be interesting to see the results of that, and hopefully exercise continues to be promising even for people with that. Your research focuses on 3 different areas, Timo. So the first one, the general aspects of fatigue. So one of your studies under this area was the age and sex-related differences in recovery from high intensity and endurance exercise. So basically, how do men and women of different ages differ from high intensity activity? So maybe something like 5 kilometers, maybe, to like, would it be like marathon running? Would that be the areas?
Like, this was one project where we looked on the fatigue fatigue and recovery patterns with regard to age and also sex and also performance levels in high intensity exercises. So not only 5K runs, but also like, for example, interval running. So high intensity interval training as another example of high intensity training was also part of that project. Yeah.
Very good. And what were like the main findings? Because what I know already is women tend to recover faster than men, I think. And I even just...
Depends. Depends.
I'm sure everything depends. In resistance training, in my sessions, I feel like my female clients recover faster, but I'm sure there's going to be, everyone is an individual, so that's not going to be the case for everybody across the board. But what were the main findings that you found in this study?
So maybe first of all, I would maybe give a quick story why we did it. I mean, it's really interesting in sport practice. We see, like, at the highest level, for example, Cristiano Ronaldo, a soccer player, really famous soccer player, who's I think 35 or 36, so already pretty old for an elite athlete, still participating in his sport at the highest level and competing against other athletes who are 20, 19 years old, for example. And the interesting topic is, of course, do they recover differently, a 20-year elite athlete compared to a 35-old elite athlete. But it's also interesting to, for example, a 50 or 70-year-old master athlete or physical active person recover in a different way than younger athletes or children. So are there different recovery patterns? Because ultimately that would lead to different recommendations when it comes to the use of recovery strategies, for example. And on the other hand, also, of course, is sex, for example, an influencing factor on recovery patterns? Do women recover in a different way than male athletes, which is also really interesting. So that was the main aspects, because, of course, I mean, we already know a lot of on the physiology of fatigue and recovery through exercise, but there are far less studies on comparing different fatigue and recovery patterns with regard to specific samples, like older athletes or younger athletes, kids versus master athletes, for example. So that is the story behind that. And first of all, I have to say we still don't know much. So there's still a really huge gap of knowledge on that topic. And before we get into that too much, we first of all have to distinguish between actually the fatigue patterns. So we always talk about fatigue, but maybe to clear that up a little bit, we have different sorts of fatigue and also recovery needs. So we can, for example, structure it from a time perspective. So when we are doing a training session, we will experience fatigue during the training session. That's always the case, and everyone knows that who's doing exercises on a regular basis. So if we start, for example, in a really intense, high-intensity interval training where we run intervals, we will experience fatigue during the different kind of intervals. And at the end of the training sessions, before the last interval, we don't feel very fresh, and the performance will decrease in the time course of the training session. So this is, we would call it like short-term fatigue. And then we have more the mid and long-term fatigue, which will show up after the training session, in the hours and days after the training session. And we have to distinguish a little bit between these sorts of fatigue. So the main finding was that children, adults, and master athletes have different fatigue patterns. So, for example, when we talk about these acute in-training fatigue, children tend to recover much faster than adults and also older athletes. So we can treat children quite hard during training, and they will still recover fast during, for example, an interval session. And there are not pretty much sex differences in this acute fatigue. But it's also hard to say if there are really differences, because it's always hard to compare. What do we compare? Like, do we compare males and females on the same performance level, like on a same absolute performance level? That wouldn't sound right. Or on the same like relative performance level, maybe then there's not a real possibility to make a clear comparison. So it's maybe still limited. So that's the huge issue when we compare the different recovery patterns. So the easiest, at least, is to say that young athletes recover faster during a training session than older athletes. And when it comes to the more mid and long-term fatigue, we see that for example, female athletes tend to recover slower when it comes to, for example, respiratory recovery. They need more time to reach their resting heart rate, for example, while male recover a little bit faster there. On the other hand, the mid and long-term fatigue is mainly related to muscle damage, which ultimately results in muscle soreness. And in relation to muscle damage, it's the other way around. So male athletes usually tend to experience more muscle damage and also more muscle soreness than female athletes. This has different kind of reasons. First of all, male athletes usually reach a higher absolute training intensity, because of higher muscle mass, for example. Also because of different hormonal stimulus, for example. So males tend to work a little bit harder. It's not a criticism. It's just like biology. So because of hormonal status, they tend to work more intense than females. So usually males in this scenario tend to develop more muscle damage and therefore need more recovery time to recover from muscle damage. And also children, for example, children usually don't experience that much muscle damage compared to adult athletes. So there's also a difference. So these are just some of the findings, which are not really trustful, I would say. So there's still a gap, as I said, of knowledge. So it's just the first direction. But which is pretty much clear is, this is maybe the strongest message from all these projects we did on that well-trained athletes are recovering better than non-trained or non-active people. So obviously it's some sort of also adaptation to training a lot. So you are able to recover faster during training, but also after training, which doesn't mean that now elite athletes don't have to talk about recovery anymore. The problem is they also train more. So they still need to focus on recovery, but they are also able to recover faster than a non-trained person, for example.
Very good, yeah. And I'd imagine there's a lot of experience that goes in with that. So if you are like Cristiano Ronaldo and you've recovered, you've done a preseason and the end of the season, you've done that for, I think he's 36. So like he's done that for almost like 19, 20 years. He's going to have a lot of almost like evidence-based practice experience to help him recover better, as well as, his body is more adapted as well. So you can kind of learn how to recover better. Do you think with experience, like what works for you as an individual over time?
Definitely. I mean, recovery management is highly individual. So if we look into recovery management for elite athletes, for example, we always have to look on the individual athlete, what works best for him or her. Also from a research or scientific perspective, in all these recovery studies we did, we see a high inter-individual variability in the response to recovery strategies. So this is just one key aspect showing that recovery management should be treated highly individual. And yeah, I'm pretty much sure, of course, that you have to find your own like recovery routines, for example, which can be based on evidence, but which also have to be based on, because of the complexity, based on experience. And I mean, like Cristiano Ronaldo as a perfect example of a highly professional athlete. He probably is planning every minute of his day to reach the highest possible performance level he as a human being can reach. And it is definitely, I mean, it's just a guess, but I think it's definitely also influenced by evidence, but especially also by experience, because he has now 19 or 20 years of experience competing on the highest level.
Yeah, a lot of time to practice the recovery strategies. So then speaking of the individual, you had monitoring, which is another area of your research. So could you talk about heart rate variability? I've heard a lot about it, but I feel like it was overhyped when it first came out initially, but you did research on it. So could you explain what it is and then how useful it is for performance?
Mm-hmm. Yeah, monitoring is, as we call it, like monitoring, or we would call it like training and athlete monitoring, is also part of recovery management. So there are mainly 4 areas when it comes to monitoring. We usually measure somehow the training load, usually the external training load. For example, we just we do a documentation or monitoring of, for example, how many minutes do you train, for example, or how many kilometers do you run, just to give you some examples of possible parameters. Then the second part of monitoring is the internal training load. So how does the athlete feel during training? The third part is the actual response. How does the athlete respond to the training, for example, in the hours and days after the training session? And then the fourth part of monitoring would be to monitor the performance level. And heart rate and heart rate variability is a famous and widely used parameter or monitoring parameter, which is mainly part of monitoring the training response. Of course, we can also measure heart rate and heart rate variability during training, during exercise. But heart rate variability in the scenario of training and athlete monitoring is most often used as a parameter or marker to monitor training response. And yeah, as you said, it became really popular in the last years or last decades. There are so many publications on that, and of course, it's a really complicated topic. But to make it easy, if we measure the response to training, we mainly want to measure the fatigue state of the athlete. And fatigue is a really complex phenomenon. Is that the right word?
Yep.
And we have different kind of physiological levels where fatigue can happen. So, for example, on a muscular level or more on a central nervous level, we can also have a purely psychological fatigue or a purely energetic fatigue when our carbohydrate levels are empty, for example. So we have different kind of fatigue levels, and heart rate variability is only able to measure one or some of these levels. So it's never the whole picture of fatigue, but it can definitely be part of the whole picture. So it can help us to get a good picture of the response and the fatigue state of an athlete, why it's still accepted and still used in practice. And I'm still convinced that it is a possible parameter because it's non-invasive. Pretty much, it's quite easy, it's not that expensive. It's not that expensive to measure, which is also important in sport practice. So I would still support it, but there are also a lot of limitations, and we maybe can talk about that also. So yeah, my comment would be it's part definitely of a monitoring system. So you can use it definitely, but you should be clear what you measure there, and you have to get into more detail into these aspects of heart rate monitoring and heart rate variability monitoring to actually understand what is happening there and to understand what do I actually measure when I measure heart rate or heart rate variability.
Yeah. So what are the limitations of it, and then when is it best used, or what's the best situations that you would recommend an athlete use a device to measure their heart rate variability?
So heart rate and heart rate variability is mainly driven by the central nervous system. So for example, if there's some sort of central fatigue, we call it central fatigue, then maybe the heart rate or heart rate variability response will change over time. So just an example, if for example heart rate variability is increasing during an overload training period, this can be a signal of training overload, of some sort of state of fatigue, which is more or less driven by central factors. So mainly by the autonomous nervous system. So it is one, as I said, one level of fatigue, and definitely disciplines or sports or loads like, for example, long endurance runs, training sessions with a high volume, periods where I have a high training volume or some sort of overload training. These kind of training loads tend to influence heart rate variability response. So in these scenarios, it can help me to monitor fatigue and recovery. The limitations are that you usually need a high standardization in the test environment. So for example, if you measure heart rate variability in a so-called orthostatic test, where you measure heart rate variability, for example, in the morning after you wake up, first 2 minutes, for example, in a supine position, and then 2 minutes in a standing position. These the environment should be highly standardized. So if suddenly, for example, your girlfriend or your boyfriend is coming into the room and starting talking to you, the whole data or the whole recording is not useful anymore. It can't be used anymore. So you need a high standardization of the test environment, which is a big limitation. And especially when it comes to heart rate variability, you need some data analysis skills. Of course, so you need to learn a little bit about that. It's not so intuitive, for example, than just measuring resting heart rate in the morning. So I think, from my perspective, for a lot of, especially also recreational athletes who want to measure something with heart rate or monitor something with heart rate, like easy parameters like resting heart rate would be the better option. compared to heart rate variability. Also, which is a really nice thing is to do a submaximal endurance test and measure exercise heart rate during these sort of submaximal endurance tests, which can be done during a warm-up in a training session. So there are really nice publications on that topic. And this is also a really good and easy thing to not only monitor short-term fatigue, but also long-term adaptation.
Yeah, very good. So it'll give you an indication of where you're at. That'll be a standardized test, the submax testing. For example, running a certain distance or lifting a certain weight. It would just be a case of measuring the athlete's heart rate at that particular weight or in duration. Is that right?
So, like I would say, like heart rate and heart rate variability monitoring is maybe related to the cardiorespiratory system and is, of course, driven by the central nervous system. So it especially sensitive to fatigue when we have high training load and high training volumes. And the main disciplines are, of course, endurance discipline, team and racket sports, where we have like quite long competition times. So it's more helpful in these scenarios than, for example, in strength training scenarios. So we have other parameters which are more helpful in a strength training scenario. Although we also see after an overload strength training cycle, for example, that heart rate variability changes over time. But the main scenario is high volume training or a period where I focus on endurance and so on. And yeah, the submaximal endurance tests, they are really good possibility to monitor fatigue and also to monitor fitness over a longer period of time. So you mainly, as you said, doing a standardized exercise, for example, during a warm-up, you run for 10 minutes at a low velocity. The velocity is standardized and you just measure your heart rate and your perceived exertion during the training session, during the exercise or the submaximal endurance test. And then over time, you can quite well monitor fatigue. I would just give an example. So if you are in a training period and you do the submaximal endurance test once per week or 2 times per week, and from first to second training session, heart rate during the submaximal endurance test is decreasing while perceived exertion is increasing, this is a clear signal of some sort of state of fatigue. Like first impression would be, okay, heart rate is decreasing during the same external load. We would say, okay, there's some sort of fitness increase. But on the same time, when we also measure perceived exertion, and perceived exertion is increasing while heart rate is decreasing, this is a clear sign that there's some sort of acute state of fatigue. And then if you do it like for weeks or even months, and you're doing it every week 1 or 2 times, then you maybe can observe a long-term decrease in heart rate while perceived exertion is staying at more or less the same level. This would be then a sign of adaptation to exercise, a long-term adaptation. So we can use it for monitoring purposes, also for diagnostic purposes. And it's like really practical and just a nice example of how to use heart rate measures in an applied setting for monitoring fatigue and also monitoring fitness and performance over a more chronic period.
Yeah, that's great. So then for most people who listen to this, I'd imagine they do strength training. So like, let's just say they squat twice a week or whatever movement they have. They pick, X weight, X number of reps as their warm-up. And a lot of people have a Fitbit now or those types of devices, mobile devices. So they could just check their heart rate at this standardized movement and weight, and they would be able to see over time what their level of fatigue is. Is that how it would work?
Not really. I mean, it is mainly published and validated in more endurance-based scenarios, why it's called submaximal endurance test. So I'm not sure if it would work if I do a specific strength training exercise, because it's really hard to standardize the situation. So in a strength training scenario, I would recommend to do, for example, if you also want to measure central nervous fatigue, you could measure resting heart rate every morning, or also heart rate variability. And in this scenario, we made the experience that heart rate variability is maybe sensitive to fatigue after strength training when you measure it in a supine position in the morning, for example. This can be sensitive to central nervous fatigue after strength training. But overall, I would, from a purely practical perspective, and if I know I don't have so many resources to measure a lot, then I would recommend to measure other parameters in a strength training scenario than heart rate or heart rate variability.
Good. So it's actually simpler than what I gave as an example. So less work. So for strength training, you looked at, in another study, you looked at sleep over a 6-day microcycle. So could you just tell us about the results about how strength training and the HIIT training affected sleep?
So actually the strength training, first of all, we would assume that when we train really hard, like when we have an really steam increase and overall training load in a short period of time, what we usually experience, for example, during a training camp. And this is what we actually did there. We did a training camp where the athletes suddenly trained several times per day, really hard for a couple of days. And like from a more theory, we would assume that sleep quality and maybe also quantity would decrease in these sort of overload microcycle. Because all the stress which is put on the body, if you, for example, experience a high amount of muscle soreness, will maybe influence your sleep quality in a bad way. What we found was that during the strength microcycle, sleep was not really influenced, so it was more or less the same as before the training cycle, while the high intensity interval training, which came along with a high metabolic demand, of course, led to a decrease in sleep quality, not quantity, but at least quality. So I would say, the overall message would be, of course, if you train hard or if you increase your acute training workload, it can or it may influence your sleep quality and also quantity. But because sleep, from another perspective, namely from the perspective of recovery strategies, is a really important topic. And maybe if I train hard, I also want to recover hard or fast, then I would focus on sleep quality even more, and also sleep quantity. So, and then we come to the aspect of sleep management. And of course, sleep is an important aspect also when it comes to recovery. And I would say, if you would ask me what are the most important recovery strategies we have, then it's the most important are sleep and nutrition, because we need sleep and nutrition irrespective of what we do. And we can still increase the quality of nutrition and also the quality of sleep. And especially when we train really hard and want to recover really fast, then we should focus on sleep management. And sleep management refers to how to increase sleep quality and also how to meet the amount of sleep that I use as an individual.
Yeah, sleep is definitely number one. It's good to hear that. So the resistance training didn't affect sleep and the cardiovascular work affected sleep. Would that have anything to do with the total amount of energy output? You could expend more energy, running for 60 minutes than you could doing a resistance training session for 60 minutes. Would that be one of the factors, or was there something else at work?
Yeah, that is one possibility. So we don't have a straightforward answer to that, and we shouldn't generalize our findings because just one study and just one and a half week observation during a heavy overload microcycle. So I would not generalize this finding and would say that in general strength training would not lead to sleep disturbances. Maybe also strength training can lead to that. But like in an elite scenario, of course, sleep is always an issue because elite athletes travel a lot, for example. So also we have to take this into account. And but to answer your question, as you said, it may be because of the energetic demands, which are higher during these high intensity overload cycle. The metabolic demands are higher. So maybe we have fatigue on more levels. Because we did high intensity interval training, also there was a lot of muscle damage, but of course they also had to try to meet their energy levels, or had to keep their energy levels up. So all these things are possible explanations. And from my perspective, I would say after the high intensity interval microcycle, different, or there were more peak levels into play compared to the strength microcycle.
Yeah, I've heard about kind of banking sleep as well. So, for example, if somebody knew that they were going to be going through a particularly challenging period of running, they might be able to get more sleep in the week before that, or maybe sleep more after that, because based on this, even though it is only one study, they might have less quality in the sleep, as you have said. So, yeah, again, you can plan and recover more effectively with more planning, and sleep is the most important, so you can get more sleep and mitigate the effects of higher intensity running. Yeah. So another area you work on is just recovery strategies. So the study looked at half marathon runners and fatigue markers. So what were the different recovery strategies that you looked at? And can you tell me the most effective strategy so that when I do my run, I'll recover quickly?
So we investigated, I would say, most of the commonly used recovery strategies. So apart from nutrition and sleep, these are psychological strategies, for example, like breathing techniques and so on. Then we investigated different kind of cooling techniques, for example, cold water immersion, cooling chambers, but also the topic of pre and pair cooling, which we again see it here now. We have these different kind of recovery scenarios. So, for example, we have disciplines where we also have to recover during the sports. So just an example, Australian Open and tennis are just over, and it is always really hot there. And the athletes try to recover also during their matches with using pair cooling strategies like ice-filled towels, for example. So we had these cooling techniques which we investigated. Then also more warming applications like sauna bathing, massage, then strategies like active recovery, stretching, and of course, when we talk about massage, we also have to talk about foam rolling, which is some sort of self-massage. So we investigated all of these commonly used recovery strategies. And like as an overall result, I would say like the most effective are still, as I said, nutrition and sleep. So these are also the strategies that are maybe where we have the best evidence for their usefulness and their helpfulness. Maybe because it's also basic needs we have, because without nutrition, without sleep, we won't really be able to compete on a high level over a long period of time. So I would say this is these are the most important recovery techniques. And then at the group level, our results indicate that I would say like all of the other popular recovery strategies do not or hardly contribute to a faster recovery of the different kind of fatigue markers. So on a group level, they were not really effective. Maybe the most effective on a group level was cold water immersion when it comes to muscle damage and inflammatory response after damaging exercises. And all of the other recovery strategies were not really effective or useful on objective levels. So some of them were quite helpful, at least on a subjective level. So for example, massage always helped the athlete to feel better, which is also an important aspect. And as I said, it is the finding on the group level. But we also said before that we have to look on each athlete, on each individual athlete. And if we look into the individual results, we always found a high inter-individual variability. Means that we had athletes who responded quite well, for example, after receiving massage or after receiving cold water immersion, while other athletes didn't respond at all. And we had also some negative responders, which can have something to do with the opposite of a placebo effect, a nocebo effect. So we had some athletes who didn't really like to go into the cold water immersion, which is understandable because it's not a really nice thing. On the other hand, a massage is always well accepted, and of course it feels quite nice, and it always gives you a good feeling and a good mood state. So we also think that the placebo effect is quite effective in this scenario. That will be the overall message. Like nutrition and sleep is the most important, with good evidence that it can also help to recover faster or recover better. All other techniques have trivial to small effects on group level, can be helpful on an individual level, and usually are not harmful, which is also an important finding. So the message would be you can still stick to your recovery routine. And if you feel that cold water immersion, for example, can help you, or massage can help you, or active recovery can help you, you can still do it because it won't probably be harmful. But on the other hand, there will be also no recovery magic after using cold water immersion, for example. That is maybe the main message.
Yeah, it's interesting because if somebody doesn't do anything for recovery or they don't have any routine, that can be kind of like unsettling. So if someone had like a routine that even was a placebo effect, routine can be very important for an athlete for performance. So if they kind of believe that what they're doing is helping and they use it all the time and the effects are minimal, then it can be effective. I'm thinking, is it important for a person to know what is actually going on as the placebo effect as opposed to like an objective performance benefit? Do you think they should know the difference between it actually improving their performance or their belief is what's actually causing the benefit?
So if I'm a coach and I know, for example, my athletes likes to go into the cold water immersion and like to go use it because the athlete is saying, I'm feeling really good after that, I'm feeling refreshed and relaxed, then I can support him or her in this feeling and this belief, and then even strengthen the placebo effect, which maybe at the end of the day maybe even has an influence on the physiological level, because placebo effect, as we know, can be pretty strong. So we can strengthen the athlete in his or her routine, beliefs, for example, and preferences, definitely. Of course, we have to take care, or we have to take into account that, for example, if we are in a competition period and we know the athletes are using cold water immersion and the athletes are saying, we are feeling better afterward, but maybe the effect on the physiological level is not so high. We still have to take into account, okay, my athlete is feeling better, okay, but I still need the same amount of recovery time, like, for example, let's say a whole day after the next heavy training session, so we need this same amount of recovery time compared to a situation where the athlete is not using cold water immersion. So it maybe does not change the recovery time on the physiological level, but if at least the athlete is feeling better is an important thing, especially in a competition period where the psychological aspect is quite important. If the athlete is feeling good and says, yeah, I'm feeling all right, and now can start with a good feeling in the next competition, is already half of the price. So that is an important aspect, definitely.
Yeah, I could think of a situation where a person, an athlete, either or, is psychologically struggling with recovery. I'm sore or I'm not feeling confident. And then they have this placebo approach, like cold water immersion, and they believe it's going to help them and it helps them cope psychologically more than anything. Then that's like a huge win, I would say. But
definitely, yeah.
Yeah.
Definitely. On the other hand, because we don't see that much effects for most of the recovery strategies, we also shouldn't force athletes to do some of these strategies. For example, if some athletes doesn't really like to go or to use cold water immersion, then we shouldn't force him or her to do it. That's the other way around. I would say that would be also my recommendation. Of course, they should focus on a good and balanced nutrition, and sleep is also important. So even though one of the athletes is saying, yeah, but I like to be on my smartphone the whole night and I'm feeling better afterwards, it's probably not the right way to recover in a good way. So of course, in some ways we have to try to convince athletes also to do maybe a better routine. But in other cases, if I force someone to use cold water immersion, for example, it's maybe also not a good argument there to force someone to do it because the effects are too small.
Yeah. It's like I think it's the Hippocratic Oath is like, first, do no harm. So if you're forcing something onto somebody, you might actually be doing more harm than good. And then also, I'm just thinking, we say there's no cost or there's minimal cost, but like there's a time investment into these, we'll call them like less evidence-based strategies. And then also there's a financial investment as well to create them. So do you think those two reasons enough are important to consider and to try and sometimes not support the athlete to use these strategies?
Definitely. I mean, it's always a question of resources. So I have to organize all these strategies. So if I do cold water immersion, I need an ice. If I doing massage, I need a therapist or someone who is doing the massage. So if I have a whole squad, for example, a team, it becoming even more difficult. So of course, I have always make a good plan and think about, is it practical? Is it useful? And compare the usefulness of the technique, and also the effects of the technique with the resources I have. And definitely, as you said, it's in a lot of scenarios really difficult to make a good decision there. But as I said, I mean, most of the recovery strategies are not that effective on a group level. So they are also not harmful, which is why on an individual level, I have a high flexibility, so I can do a lot of things to work through and find a good routine for my specific athlete, for example. And a lot of different kind of ways that maybe work best for a specific athlete.
Yeah. So a question that comes to mind is, as you know a lot of information, you're a coach, you're experienced, and you're active as well. Is there any of these strategies that you use yourself based on everything you know, even though the research is not very strong to say you should use them?
I mean, so usually also myself, but also if I work with other athletes, for example, we are always following some sort of guidelines on how to choose recovery strategy. So I use these guidelines for myself, but also for the athlete. And these guidelines are related to three key aspects. The first aspect is timing. So I have to think about, when do I want to use what kind of recovery strategies? Do I want to use something during exercise, after exercise, or before the next exercise? Because we have different kind of time points to use recovery strategies, as I already said before. Because we also have different kind of different fatigue levels from a time point. So, for example, if I am in a training session, in a running based interval training session, and for example, I'm doing 4-minute intervals, high intensity intervals, then I have to think about, should I do, for example, active recovery during the intervals, or should I just recover passively during intervals? And if I then do these high intensity interval training in the heat, then I have also to think about, should I use any cooling strategies during my training session to increase, for example, training intensity or training quality, or shouldn't I use it? So the timing is really important, and the timing influences the choice of recovery strategies. Another example, if it is hot and I want to use pre-cooling strategies, so try to cool my body before I start with the training, and the training is like a speed training, for example, or power training, and I use cold water immersion immediately before the training session, it will diminish my performance. So I have to take into account the time point, and based on the time point, I should define what kind of recovery strategies I use. So, for example, with cold water immersion, we see that it is most helpful if I use it directly after the training session, if I have the risk of experiencing muscle soreness. So if I use it directly after a training session, there's a chance to decrease the inflammatory response after muscle damage. While maybe on the next day, after a fatiguing exercise, it's maybe more helpful to have more these warming or blood flow increasing recovery strategies like active recovery or massage, which also helps me to reactivate before the next training session. So these all aspects are part of the choosing aspect of timing. And then we have the second aspect, which is the sports and discipline specificity. So we always have to think about the possible mechanisms of a recovery strategies and how these mechanisms meet the fatigue mechanisms of a specific sport or discipline. So just an example, if I do a heavy strength training and there's a high risk of muscle soreness, cold water immersion will probably help a lot. But if you have a long swim where you have high energy demands, but no muscle soreness at all, and you are already in the water during the whole session, probably cold water immersion after the session is not really a good thing or logically to use. So it's maybe more important to concentrate on nutrition, to get a lot of carbohydrates, and to restore your glycogen store. So just two examples of how exercise specificity should influence your choice of recovery strategies. Last example for this, again, we have the Australian Open, for example, or the Ironman, or a lot of other sports and disciplines where the load is, or where the competition is held in hot environments, then it's probably not really helpful to go into the sauna after the exercise, because you already have a lot of heat stress during competition, and then again, heat stress in the sauna is maybe not a good idea. And then we have the third aspect, which is individualization. So meet the preferences and beliefs of the athletes, and also look on the in-real effects. So if it's some sort of possible to measure or document how the athlete is responding to a specific recovery strategy. So for example, if an athlete is using cold water immersion during a training period a lot of time and always feeling really good and feels that it is helping him or her, then it's maybe also a good thing to use it during the competition period. But on the other way around, if someone is using foam rolling and is not liking it and always feels bad afterwards, then you shouldn't force him to do it and to use it. So these are the three main aspects, and they are like framed by the aspect of evidence informed. So of course you should choose recovery strategies based on these aspects, and it should be framed by evidence. So that would be the long answer of your question, and that is what I use also. So for most of my sports, I usually concentrate on nutrition and sleep, because I know this is most helpful. So I try to stick to a good sleep routine to get my sleep quality and quantity. And I have my nutrition rules. And then from time to time, just because I know it feels good, maybe I get a massage or something. But because I'm not an elite athlete and I know I don't have to concentrate that much on recovery, I feel that nutrition and sleep helps me enough to recover from the demands I have in my job and also in my personal sport experience, I would say.
Yeah, I like that. The guidelines are evidence-based. So then you take out a lot of, or as much guesswork as you can by following the evidence really effective. So then the last question, but the main reason that we are having this podcast is the meta-analysis on the effects of foam rolling. So could you just explain what a meta-analysis is, Timo, and then talk about the recovery strategy of foam rolling and what the study found?
Mm-hmm. Yeah, meta-analysis is some sort of systematic review where you not only look into the studies, but also do a second analysis of the different effects of different studies. So you try to find an overall effect of a recovery strategies in this case, based on all studies that have been done on the topic of foam rolling. And of course, you don't include all of the studies because there are studies with, for example, methodological issues, for example. So you have to exclude some studies, but in a meta-analysis, you have always some sort of collection of original research studies, and you analyze like some sort of mean effect size for an intervention or a treatment based on all effects of all original studies. Yeah, as you said, we did these kind of meta-analysis with regard to foam rolling. I would say a really popular recovery strategy, which has been becoming more and more popular in the last, I would say, like 5 to 10 years. I think one main reason why it is really popular is because it's really cost effective and everyone can use it, part of their training plan. And we have to distinguish. So it's usually used during warm-up. We call it pre-rolling, and also during the recovery period after training, and we call it post-rolling. So we have to distinguish between these two scenarios, I would say. And foam rolling as pre-rolling is mainly used with the aim to increase performance during the following task. And we see that can maybe have a small effect on sprint performance. On the other hand, no study showed any effects on strength or jump performance, which is why we would say it's not a really clear effect. So it's small. Small means that it's maybe helpful for elite athletes, but definitely not for recreational athletes. But it has an acute effect on flexibility. And the reason for that, I will explain in a minute, because we can also now look on the effects of post-rolling on recovery. And the main aim of recovery, of course, is to recover or to reach the initial performance level in the shortest possible of time. So usually we have an initial performance level, then we train hard, we are in a state of fatigue, so the performance level is decreased. And with the use of recovery strategies, we try to reach at least our initial performance level, or even super compensate our initial performance level in a shorter period of time compared to not using any recovery strategies at all. And in this scenario, foam rolling is not helpful to decrease the recovery time, reach the initial performance level, but it can help to at least acutely decrease muscle soreness. So it has some sort of analgesic effect. Also, the reason probably why it acutely helps to increase flexibility, because the mechanistic explanation for that is that foam rolling influences the pain sensitivity of our pain receptor. It's a quite easy and common observation that is pain inhibits pain. So foam rolling can be a little bit painful, and because of this, it influences the pain sensitivity, and therefore in the minutes or also in the hour afterwards, the pain that we experience decreases. So muscle soreness decreases, and also flexibility increases. Because when we stretch, it also can be painful. When we have like an increase in pain tolerance, we have also an increase in stretch tolerance. So overall, I would say foam rolling on a group level is not really effective when it comes to recovery purposes. Only on a subjective or muscle soreness level, it can help for a couple of minutes or for an hour to feel better. So based on that, our recommendation is to use foam rolling during the warm-up. So for example, if you still have muscle soreness, but I have to train now, maybe help to your well-being, which then will help you to perform better during the training session. But it's not so useful to use it after a training session during the recovery period, even though you can still use it because there may be no harmful effect, at least if you don't use it in a too painful way. So you can still use it after training if you feel muscle soreness and want to work on that a little bit. But the main area would be during the preparation for competition or training. And this is also interesting. Maybe this as the last sentence, we did a nice study on maybe also harmful effects of foam rolling. So we rode with different kind of intensities, means with different kind of pressure. And we used a pain scale from 0 to no pain at all to 10 to the maximum imaginable pain. And they rolled at 8 to 9 on the pain scale and on 3 to 4 on the pain scale. And both times after a heavy training session, after a really intense strength training session, and after rolling with a pain level of 8 to 9, muscle soreness even decreased more. So we had muscle soreness, of course, after the strength training, but muscle soreness was even worse after rolling really hard. So this is maybe also some interesting information. So if you use foam rolling, don't treat yourself too hard, too painful with that.
So I was going to say that if it decreases pain, then a UFC fighter, or a combat sports athlete, could use foam rolling to reduce the pain sensation because of the combat, right? But you've just proven that is not the case because it actually increases the soreness. So it seems like foam rolling is like overhyped. Would you say that's fair to say?
I don't know if it's really overhyped. I mean, I can understand the trend because it's cheap and therefore cost effective, and the athletes who are using it some sort of feeling better afterwards, which is maybe related to the analgesic effect, so that pain inhibits the pain, which is first of all a good thing. So if you feel better, you can use it because in most of the scenarios we probably don't see any harmful effect. So I wouldn't say it's a hype. So it's a reasonable or understandable trend, but I would say from a more marketing perspective, of course, there are it's a huge industry also. So there are a lot of companies selling these foam rolls. Of course, I would say the effects are far smaller than expected by most of the people, and also how it is communicated to a lot of athletes. So that is the main finding, I would say.
Yeah, very good. Is there anything that we didn't cover or anything you want to mention?
There's a lot of things we didn't cover. I mean, it's of course, from my perspective, because I did research for more than 10 years on this topic. There's a lot of things to talk about. And of course, we can talk about all these different kinds of recovery strategies in detail. So I think the most important thing is if you want to use recovery strategies, always keep in mind these 3 aspects: timing, sport specificity, and individualization, to find a good and reasonable way of using recovery strategies. And maybe also, if it comes to the overall concept of recovery management, try to keep in mind these main 2 areas. So recovery management is always monitoring of fatigue and recovery on the one side, recovery planning, so planning the use of recovery strategies on the other side. And both, of course, are related, because if I use monitoring, I get information of when is my athlete in a state of fatigue and maybe needs more focus on recovery or recovery strategies. And when is my athlete in a state of readiness, where maybe recovery strategies are not so important, where I can train really hard, for example, and stress my athlete. So both aspects are, of course, highly related. And then, of course, when it comes to more detail, we could talk about specific parameters. So everyone should think about their specific discipline. So if you work with strength athletes, they need different monitoring systems than in endurance athletes when it comes to the parameters that you measure. And the same applies for recovery strategies. So maybe an endurance athlete needs different kind of recovery strategies than a strength athlete or a team sport athlete. Depends on the environment and all these aspects.
Yeah, it sounds like know your field that you're working in or your sport you're working in, and then know your individual self as well. So you can kind of navigate that situation and the time as well to maximize recovery and hopefully boost your performance.
That's it, pretty much. And I mean, first of all, maybe that's the main message I would have. Concentrate on nutrition and sleep first from a recovery perspective. Because with most of the athletes, there are always things that can be improved when it comes to nutrition and sleep, and this will already help a lot.
Yeah, there's such big areas. There's nearly always room for improvement in one of those two. So, Timo, this has been great. Thank you very much for your time. I'll attach, any links that I can to the podcast when it goes up, and keep up the good work.
Yeah, thank you very much, and thank you very much for the invitation.